Wednesday, April 13th at 6:15 p.m., we're going to be doing our upper extremity workshop. That's the shoulder, the elbow, the wrist, and all the problems and pain issues that comes along with that. Today, I want to quickly go over what some of those things might be coming from and really just even describe the muscles of the shoulder. So obviously, brain's the boss. All the information to tell that shoulder what to do to feel that pain and discomfort has to get from that shoulder, up the nerves, from the shoulder into the neck, and those run into the lower part of the spine and through here, and then up to the brain. You can imagine if your spine does not have a normal curve, like a C in the back of it, maybe your head is forward, right? Or it's shifted off to the side, right? Like a cute dog. That's gonna put stress on those nerves called subluxation, which is going to block the signal from the brain to the shoulder and from the shoulder to the brain. That's certainly gonna impair the healing ability of the shoulder or anything on the upper extremity. And that's the first thing that we want to address. And when it comes to the shoulder, there's multiple muscles that make up the shoulder joint. Many times people come in and they say, I've torn my rotary cuff or rotator cuff. There are 4 muscles that make up the rotator cuff. The first one is the supraspinatus. That's the one that's the top of the scapula right through here, and it runs to the top of the shoulder. This right here is one of the most common ones to be torn. We also have the infraspinatus. It's a bigger, wider muscle. It's at the bottom of the scapula, and it runs around and again surrounds and supports that shoulder. We have a smaller muscle about the size of your finger that wraps around and called teres minor. And then we have a flat muscle that's on the inside of the scapula between your rib cage and the scapula, the wing bone here, and that's called the subscapularis. Those are the 4 muscles of the rotator cuff. And those are 4 of the muscles that could be damaged, injured, or not working properly. You also have the deltoid, which is the big muscle of the shoulder, the pec, which can also pull and draw that shoulder forward out of its normal position, which can also cause dysfunction of that shoulder, leading to pain and other problems like fraying or tearing of those tendons and ligaments in there. And then you also have the latissimus dorsi and a few other smaller muscles in there that strengthen and hold that shoulder into place. So again, a little intro into our upper extremity workshop, which is going to be happening on Wednesday, April 13th. It's going to be at 6:15 p.m. Love to see you there. If you or a loved one, a family member are having issues with your shoulder, your elbow, your wrist, we're going to teach you to think like a chiropractor, think like a doctor, and what you need to do from a natural point of view to help yourself correct the underlying cause if possible, and restore that upper extremity part of the body to its normal function. I hope to see you there.
Hey guys, Miguel here from Chiropractic. So I'm going to show you how to sign in on this computer. So 2 different options. You can use your cell phone number on the iPad, or if you have your key tag, you're going to come over here, we'll scan it. Sometimes these things are kind of finicky. Hear it beep first. Make sure you look at the screen. Okay, we see a green screen in the background. That's what we need to see, okay? And then you also see your picture there. So once you see that, that's how you know you've done it right. If it's ever red or gives you an error, please let Sheree know immediately. So please make sure you look out for that screen first before you go back to take a seat. Otherwise, you'll sit here forever and we'll call you back.
Please proceed to table 1.
I want you to hear that. Once you hear your name, it's going to call your name to a table. So we're going to head back to table 1. Remember, there are 5 tables. Every table does have its own number. The numbers are either above the doorways, so we have 5 to our right, 4 straight ahead, 3, 2, and 1. I'm on table 1. So, this is not supposed to be there. So, we're going to look in the top left-hand corner. My name is right there. Make sure your name is there, so you'll see your name there. And then you're going to use the mouse. This is not touchscreen. So you use the mouse, and I'm going to click on barcode. It's ready to go. And then you'll get your key tag and scan it. You'll hear it beep over here, and you're going to see the screen pop up. Once you see the screen pop up, the spine on the left side, that's how you know you've done it right. After that, I want you to go face down on the table, okay? So you're going to go face down on the table, nice and relaxed, happy thoughts. So it's been a long, stressful day. Come in, get your power turned on. I want you to relax. That way your muscles relax too, so you get the best adjustment possible. Miguel here from Chiropractic. Have a great week.
All right, guys. So you've been a patient for a little while. Maybe it's been weeks, months, or even years. and all of a sudden that nasty headaches, neck pain, numbness, tingling, back pain starts creeping in again. What should you be thinking? Well, think like a doctor. Think like you're running your body like a machine. What happened in your life that maybe in the last week or month or last couple of months, what has changed, whether you're doing something new and adding something or you've taken something positive away, what's changed that might be contributing to some of this new issue? And so I always say health is never static, it's always changing. And so what changed in order for your health to perhaps in this case show another symptom or show a sign of decline? So the first thing is are you doing the home exercises? The wobble exercises every day, twice a day? Are you laying on the rolls? So those rolled up either the pool noodle about 2 to 3 inches underneath the neck and the low back. Make sure that you're doing that for about 20 minutes every single night, right? Are you doing the home exercises? So at this point, most of you guys listening should have a custom list of home exercises that's going to help stabilize the spine. Remember, the adjustment's the most important thing that we do here. It takes the pressure, it moves the spine, it takes the stress off the nervous system, which allows your body to heal. But if you're very quickly going from that position, maybe you broke a toe and you're hobbling around and that's throwing off your gait, causing you back pain. Maybe you're in a different sleeping position because you got a new mattress or you're on a different side of the bed. Maybe you are finding yourself looking at a computer or staring at a screen in a different way for longer periods of time. Maybe you got a new couch or a new chair and you're in a different position when you're watching TV or doing something chronically. All of these little life changes, which seem kind of benign at the time, can stack up and lead to a shift in the spine and that irritation of that nerve, which can cause that increase of back pain, neck pain, or headaches. I hope this helps, and I encourage you, if you're noticing a new issue or an exacerbation of an old one, what happened? What changed? And then what can you do to start switching it back to get those improvements like you had before? I hope this helps. Can't wait to adjust you this week.
Alrighty, so I'm going to be taking you through the wobble exercises today. There are 3 of them. We recommend doing them twice a day, in the morning and at night, right on the edge of your bed, because it kind of simulates this wobble. So I'm going to be demonstrating them. The first one we call is the tuck and expand. So what you're going to do is bring your elbows to your belly button, your chest to your belly button, then your head to your belly button. Then you're just going to open that all up, lean that head back, and then tuck that back in. So 1 full repetition is the tuck, expand, and back. You're going to do 15 of those for twice a day. So the next one is the side tilt. What you're going to do is you're going to bring your ear to your shoulder, shoulder to your waist, and then similar to the tuck and expand, you're just going to open that all up and re-tuck it again. Open it all up and tuck it again. 1 repetition is both on the right and left side. The next exercise we're going to do is sitting on the bar. What you're going to do is bring your arms and elbows up, and then you're just going to look, leading with your head to the right side, and then to the left side. That again is 1 full repetition, 15 repetitions in each, twice a day.
Hey guys, Dr. Utash here, Wellness Key Chiropractic. Many people suffer with low back pain. If you're one of those people, you know that simple low back pain can affect every other aspect of your life. And so here's a simple muscle activation that you can do anywhere that many of our patients have found alleviate some of that low back pain. So perhaps this works really well if maybe you're starting to get that stooped over posture. And so rather than just trying to force it up with your low back muscles, squeeze the glutes, really suck in the tummy, hold it there for 5 to 10 seconds, and then relax. Repeat 5 to 10 times as necessary, and you'll realize the activation of the glutes can actually decrease some of that back pain. I hope this helps. Dr. Utash, Wellness Key Chiropractic. This is a great exercise for stabilization, also for people who are starting to get a little hunchy, maybe sit too long. So one-legged stands, great for stabilizing the foot, the ankle, the knee, the hip, the pelvis, the core. So make sure your chest is up, your glute is activated, your scapula are retracted and back. You're gonna push. If this is all we can do, start with this. Next level will be taking a weight, keeping the scapula back, bring it out, bring it back, bring it out, bring it back. Great for stabilization of your posture.